Hello. In this session, we'll look at factors that influence management of healthcare institutions. We will be focusing more on PESTEL approach. Health institutions basically operate in a very dynamic environment, and for that reason, there is need to adapt and readapt, learn, relearn, in order for those health institutions to survive and for them to operate effectively and efficiently. That means there's need to understand their environment and learn to adapt using very specific skills and techniques. For us to understand the environment, then we need to be able to analyze it. The number of different tools which are used in environmental analysis. One is a SWOT analysis, the other is PESTEL. SWOT analysis, which basically stands for strengths, weaknesses, opportunities, and threats, basically applies to internal factors, while PESTEL, as we shall see, often focuses on external factors. PESTEL, which is our focus for today's lecture, was first introduced by Franklin Aguirre in his 1997 book. If anything, in the last few years we've learned, last 2-3 years we've learned, is how environmental factors can highly impact health institutions. COVID has provided such a learning scenario and opportunity. So the PESTEL framework is basically a tool that is used to analyze the external factors and events that influence how organizations run in common. And the PESTEL is an acronym for political, economic, social, technological, environmental, and legal aspect. It is an important part of strategic management, as PESTEL framework helps us look at the microenvironmental scanning and we see how they are interrelated. So it basically tells us the organizations, even as you draw strategic plans, do not operate on their own. We have an internal environment and we have an external environment, and all will affect how we run our health institutions. So this PESTEL approach is very important in health because it helps organizations focus on 6 factors considered in strategic management of institutions and organizations. Of course, the 6 factors are what is portrayed as PESTEL. That means institutions need to be proactive, and institutions also need to align with needs of local and international populations. So what are some of these political factors, and why is it important to analyze the political environment of any health institution? We know that politics play a very important role in healthcare industry. The government is, in most countries, is the highest provider of health services, and we know it acts basically as a regulatory body. And then they're also the highest purchasers and many other roles of the government. That tells you political stability is important or is key to functioning of healthcare systems. Whether we are talking about private healthcare or public healthcare, political stability is key. But political factors in PESTEL approach basically look at public policies, legislation, consumer protection acts, taxations, and all those other issues which will have an impact on a health institution. Government subsidies in healthcare, for example, healthcare workers' protection, insurance, overtime, all those will influence how we run our healthcare institutions. It's also important to know that healthcare institutions and healthcare systems have to adhere to tax policies. We have to adhere to regulations or rules like client-patient protection and employment regulation. Therefore, strong policies by the government may interfere with the health systems positively or negatively, directly or indirectly. For example, when political leaders deal directly with medical employees, like especially during crises, when there are strikes, it's labor movement, what happens? It tells you that politics still is the backbone of survival of healthcare institutions. In Kenya, for example, a political action happened the other day. We had a new constitution, and it we had devolution of healthcare from central government to the county government. Of course, that may have brought, well, it did bring services closer to the consumers of healthcare, but it also had its own political implication. Imagine if you have a governor who appoints a CC who may not be the best healthcare manager. But there are those counties which have really done well in health sector. I think Machakos has been one of them, at least for a while. We had Makueni County and many other counties. So there is a positivity in devolution, but we need to remember that devolution of healthcare system was basically a political factor. Another factor we need to consider when we are handling healthcare institutions is economic factors. When inflation happens, it affects health institutions. Where there is unemployment, when interest rates rise or fall, when the cost of raw materials increase, when we have foreign exchange dynamics, all those economic factors have a direct or indirect influence of healthcare performance. Remember, all those factors impact the economy and its performance, which in turn will impact the organization and its profitability. Economic factors will impact the purchasing power of clients, especially when we are looking at private healthcare institutions. Economy will determine whether the government will employ or not. Imagine if we have unemployed nurses, like the current situation we have in Kenya, and yet we have shortage in hospitals. That means we are going to have not very high quality delivery services, and not because there are no qualified staff or nurses in the country, just because the capital of the country may not allow us to employ extra nurses. It's quite a balancing act. It's not only we are not talking just about nurses alone. We have many other healthcare providers or professionals who are out there who are yet to get job opportunities. Now, it's not only human resource which is affected by economic factors. Unavailability of funds to purchase essential commodities are some of the things which are affected. When we do not have essential commodities, especially in the public sector, running those institutions become quite an uphill task. Is it only politics and economics which affect management of health institutions? No. We have social factors. When we talk about social factors, we are talking about social environment and identities emerging trends. Social factors basically means we have to look at what population do we serve? What are their demographics? What are their beliefs? What are their values? What are their traditions? What are their educational levels? Their cultural trends, their attitude to change, and their changes in lifestyle. That will enable us to understand our consumer needs and wants. And remember, we are more interested in meeting the needs before we can meet the wants. We need to consider the community each health institution operates in. What are the prevalences and values of that community? Remember, some of the community beliefs may hinder or promote the utilization of health services. We need to align our health services with these social factors for us to report a higher success rate of managing health institutions. What about technological factors? Remember, we've had exponential growth of technology within the last 2 decades. How does that technological advancement affect healthcare? We need to be sensitive to new technological developments and innovations and ensure that we adapt them to health industry. We have changes in digital and mobile technologies. Now we have automation, research, development, we have computerized health systems, we have health informatics being applied, and all those. And apart from that, we also have distribution distribution, manufacturing, and logistics being learned on technology and running on some serious platforms. Remember, whatever external technological changes happen, they do affect healthcare directly. The most important is to take advantage of technological opportunities and use them as advancement opportunities for managing healthcare institutions. Environment. I know we used the term environmental first up there. We're looking at the general environment. But when you look at environment within the pastel approach, we are actually looking at the physical environment. We have heard of issues of lead. Organizations taking part in leadership in energy environmental design. That should be able to tell us we're thinking about climate change and conserving our physical environment. So many hospitals and health institutions are actually interested or they are adopting environmental friendly building designs, waste disposals, and others are focusing on use of renewable energy. The other day, we had a proclamation that every newly built hospital or house should have a solar energy installed or solar panel installed to use renewable energy. Of course, it's renewable energy. We appreciate that we're using that, but at times I wonder, how are we going to dispose of all those equipments of solar panels once they cease functioning? So we also have to look ahead and think e-waste management systems. As much as like we have said, environmental factors in pastel relate to the influence of the surrounding environment. We need to be cautious of climate change and mitigations which have been adopted worldwide. Ecological aspects need to be considered. For that reason, most health institutions have corporate social responsibility, which should look at pertinent issues which include climate change, recycling procedures, carbon footprint, waste disposal, and sustainability, among others. Legally, what do we need to consider even as we run our health institutions? The organization or health organizations must understand what is legal and what is allowed within the territories they operate in. We need to be cautious of the laws of the land. We need to also evaluate existing and impending legislation and ask ourselves, how will it impact healthcare? How will it impact the health institution that I am charged with the responsibility of running? Remember, legal factors also influence issues of employment, consumer laws, health and safety, international as well trade regulations and restrictions. You don't just import a gadget into the country just because you found it somewhere. There are rules and regulations which guide in product evaluation so that we are able to protect our citizens. And that is actually a very legal and political process. More often than not, we have political factors overlapping with legal factors, and you can imagine why. Safety and health laws that organizations in healthcare provide or must follow existence of these laws. That is very essential in regulating the operations and provision of quality health. Well, let's look at something else. We may not go to the depth of how to conduct a pestle analysis, but I just thought I should just mention a few things. Before you sit to do a pestle analysis of the health institution you're leading, there are a few things we need to note or follow. One, it must be done by a set of multidisciplinary team. Every stakeholder, if possible, should be included in that team which does pestle analysis of every institution. All knowledge is not contained within, so we need to consult expert opinion outside of the organization. And once we've been able to enumerate the factors we thought could affect our health institution, then we do research and gather evidence. We analyze that evidence and we score insight depending on likelihood of happening and possible impact of the same. Then we take action to either leverage potential opportunities or mitigate potential threats. So that is how we look at pestle approach in management of health institutions. Of course, we can apply this pestle approach in a number of places. It has been employed in analyzing e-learning in healthcare industry. It has been used in analyzing human resource in healthcare industry. It has been used to analyze use of blockchain technology in healthcare organizations. So it is not just a vague instrument. It is actually a framework that can be used to analyze different aspects of healthcare. We can read further from a number of references. Those are just selected references which we have shared. Until next time, take care and enjoy the ride. Thank you.